Good afternoon, Facebook. Hi, I am Dr. Mesheca. Welcome to an impromptu I Have a Question. I know I didn't announce it today, but it's such a nice day outside, so I wanted to come out and join you live from my front porch in Maryland. So I'm just going to wait a couple moments to see who will join me this afternoon. I know that a lot of us, especially my colleagues, are home, probably working on their businesses remote. Some of you may even be still in your offices seeing emergency patients. But I just wanted to come on live to talk to my viewers about COVID-19 and how exercise can be of benefit to us. All right. So I'm going to go ahead and get started on this afternoon. It is lunchtime, so if you are home with your children like I am, you are probably getting ready to prepare lunch. I am Dr. Mesheca, as you know. I'm a leader in optometry for over 20 years, and I have a passion for educating the public on eye health and eye beauty. I do so through my live streams and social media, as well as public speaking. You can find me on all social media at Dr. Mesheca. That's DrMesheca. And like I said, this is impromptu. Hopefully, if you are joining this or catching me on the replay, I want you to please put hashtag replay in the comments so that I know you're here. Let me know where you are joining me from as well. So, like I said, today I'm at home. It is a beautiful sunny day here in Maryland. I believe the last time I checked, it's supposed to be in the 60s here today. But I wanted to come out, and I do this at least a couple times a week now, just to come out, take a walk, especially on a beautiful day like today. But right now, I finished my exercise, and I am just joining you from the porch today. Okay, hello Willis Bolden. Thank you for watching. So today I'm just going to talk about the benefits of exercise during this crisis. I know that most of us are home, and there's a lot of information that's being thrown at us from social media. And if you're like me, I've been watching the presidential briefing just about every afternoon, which I probably should not be, because it is a lot of information, and sometimes that information can cause what one of my super friends, Dr. Lakeisha, says. She says it's called infobesity. It's just a lot of information being thrown at us, and we have to do something to try to filter some of that information as well, and get away from it from time to time. So the benefits of exercise that I want to talk about, the first, since I am your eye care provider on social media, I want to talk about that exercise keeps your eyes healthy. Well, there's a caveat. Indirectly, exercise keeps your eyes healthy. So as you all probably know, and for those of you who don't know, there are many systemic problems that occur in your body that can have an effect on your eyes. Specifically, diabetes can affect your eyes, high blood pressure, heart disease as well, and quite a few others, but I'm just focusing on those right now. Well, with diabetes is actually one of the leading causes of blindness. And what happens is that the blood vessels in the back of the eye, they get very fragile and leaky, and they start to bleed. The blood vessels start to bleed. So you develop bleeding in the back of your eyes that can actually lead to blindness. So the second The second systemic disease that I want to mention is high blood pressure, which affects millions and millions of people. High blood pressure is another disease that can affect the retina. It can cause bleeding in the retina, can cause swelling of the retina, which is the lining on the back of the eye, as well as swelling of your optic nerve. The optic nerve is what connects to the brain and actually gives us sight. So these are just a couple of things, systemic diseases that can affect the eye, as well as cardiovascular disease. There have been some cases that I've seen personally where I see plaques that are building up in the retinal blood vessels called Hollenhurst plaques. And that tells me that someone either has or is at risk for cardiovascular or heart disease. So how does exercise indirectly affect the eye? Well, exercise helps to decrease blood sugar, so that's a positive effect on diabetes, and it also helps to lower your blood pressure. So as you can see, exercise really does help the health of your eyes indirectly. The second benefit of exercise is that exercise outdoors, because I'm outdoors today, and this is what I'm talking about. Exercise outdoors. It actually increases vitamin D production. So vitamin D is produced whenever your skin is exposed to the sun. So it's definitely very beneficial for you to get some time outdoors and exercise, especially on a beautiful day like today. So vitamin D, what is vitamin D actually good for? Well, since I'm talking about COVID-19, one of the benefits of getting a lot of vitamin D, guys, is that it really helps our immune system. So that is even more, that's probably the number one reason why I would say on a day like today, just get up, go outside and get you some vitamin D directly from the sun. Another thing that vitamin D helps, it helps with inflammation. I was reading an article a couple days ago about how vitamin D specifically helps with inflammation in asthmatic patients. You know, from what we're hearing about COVID-19, it directly attacks, or the virus attacks your lungs. So what better reason to get out and get some sun? If you have asthma, of course, you consult your doctor with any exercise program, but light walking in the sun, getting your vitamin D, it seems to me like it really would be beneficial to inflammation as it pertains to asthmatics and just in general. Some other things that vitamin D can help, it actually helps your brain and mind. It has some effects with some positive effects on allergies. So even though this time of year people like me are suffering with allergies, vitamin D actually is a protective mechanism against allergies as well. So those are two reasons so far. The first thing is that exercise indirectly affects your eyes. And the second thing is it helps with, if you're outdoors exercising, it helps to promote vitamin D, whose affects the top two as it relates to COVID-19 is helping your immune function as well as helping with inflammation. The third reason why exercise really helps during this particular time is that it stabilizes our mental health. So, with all of this information that we're being thrown at about this deadly virus that has affected, it has spared no community in the United States as of yet. We have to get out and we have to just really reset our mind. Walking or running, just being outdoors, it just helps your mental capacity. Exercise in general releases good chemicals from the brain that does help with mental stability. increases your mood and decreases depression and anxiety. So, one of the reasons why I actually came on today is because, I have a question. And I was asked a couple of days ago, hey, does exercise really benefit your eyes in any way? And so the answer is yes, it does, indirectly. But not only that, during this time of COVID-19, I want you to remember to get out and move, because exercise, again, helps with vitamin D function, which improves or helps with inflammation and immunity. And the third thing is that it really helps your mental capacity. Just get away from the TV, get away from social media. Today I'm playing with a new device that my family bought me called the Osmo. So this is a perfect day for me to get out and use this tool to come on live with you all to give you some information. So again, my name is Dr. Mesheca, leader in optometry for over 20 years, and I provide information about eye health and eye beauty through social media outlets and public speaking. I would love for you to share this video with your friends and family members, because everyone can use a break from all of this infobesity that we are plagued with in terms of COVID-19. Get out and get moving today. Thank you so much for joining me, and have a great day. Bye.